but just wanted to get you all back into this room because we've got a fabulous session for you, and we wanted to get all your faculties in order to absorb this conversation. It's going to be a fabulous one. We've got a fireside chat happening, enabling preventive health at scale, and it's an honor to have with us Mr. Vishal Gondal, founder and CEO GOQii, who's here with us. Let's put our hands together and welcome the gentleman on the dais. And of course, we'd like to call on stage Ms. Urvashi Prasad, Director, NITI Aayog, to join us on the stage as well. I'll request you all to get the lady up with a round of applause. Ms. Urvashi Prasad. Is she here? She's running late? Well, that figures. We've got a rain happening outside. Ms. Charu, Kaushal, CEO, Allianz Partners, will be moderating this panel. In the meantime, ladies and gentlemen, please put your hands together for the lady. So as soon as Ms. Prasad is here, I think she'll be able to join the conversation. In the meantime, I'll let you both take this forward.
Okay, so I'm told that this is one of the last sessions, and that explains towards the end of the day. This is a relevant session because when I interacted earlier in the day, I think a lot of people in this room work towards preventive healthcare. So it's a good topic to talk about because I think there are a lot of you from startups here, and the whole ecosystem really works on preventive healthcare. So it's a pleasure to chat with Vishal, and we can start it by asking you, what is it that you think preventive healthcare is all about? And why is it even important to enable it at scale?
Yeah. Again, thanks a lot, IAMAI, for inviting us for this session on preventive healthcare. The best example I give is, let's imagine that there is a highway. And in that highway, there are cars crashing into each other. There are many accidents. The solution the government and everybody else comes up with is that to fix this problem, let's create more garages around the road, have more mechanics, and create the entire infrastructure taki accident ho to you can repair the car, or if there is an ambulance, etc., etc. By that, clearly, we were able to make sure that post the accident, there was care available, but that did not reduce the number of accidents. In fact, on the contrary, you can imagine these mechanics and garages were competing with each other to get more customers, and that also led to more accidents. Whether they are right or wrong, that can be debatable. Unfortunately, the solution for this problem was not about creating the infrastructure on the mechanic side, but the solution was to make sure drivers are driving their cars properly. They are maintaining discipline in lane. The cars are well serviced. The roads are well serviced. And that is the approach which can lead to lesser accidents. And we now know that in all our highways, the government is enforcing, radar cameras, etc. And that is what is leading to lesser mortality on the roads. We are facing the same problem in the healthcare system, where the solution for healthcare is always thought about as more hospitals and more doctors and more medicine. And I'm not saying that's not important, but the real problem which needs to be sorted out, especially in a country which is suffering from non-communicable diseases like diabetes, cholesterol, and all of those things, is about changing the people's behavior itself on how they lead their daily lives. And that's where the preventive healthcare model comes in, which is not about waiting for you to crash your car or fall sick and enter a hospital or a clinic. It is all about doing the measures which will avoid that instance in the first place. So even though that happens, you are driving at a slow enough speed that this is not lethal. So the way I think about preventive healthcare is, this is the future model of healthcare itself, post a situation like COVID, where we saw what happened.
Yeah. So I think that's a very good point, because in India, we mostly have the curative model, and the preventive kicked in and got a life of its own definitely after COVID. and since we are at this summit, which is really digital health, when we look at the numbers, we are really seeing that the preventive healthcare market itself is likely to be $197 billion in 2025. And a lot of this will be fueled by startups. Here, what we see is that preventive healthcare is meant to include fitness, wellness, food supplements, diagnostics, and health tracking. So you want to shed some light on the role of startups in really taking the preventive healthcare ecosystem where it is today, and how is it likely to evolve over the next few years?
I think, first of all, people don't understand the market of preventive healthcare. People are confused कि preventive है क्या? Is it diagnostics? Is it, eating some supplement? What is the market segment of preventive healthcare itself? Because when startups think about it, there is some kind of confusion on what it is. And again, let me give you a perspective that how many of you today walked from your car to this venue or took a metro or a train or a cab? I assume 100% of you. How many of you, not all I assume, had a cup of green tea today which was available outside? Green tea. Yeah, किसी ने तो पिया होगा, I assume. So, preventive healthcare is all about choices you make in every walk of life. Right from the time you wake up to what is the first drink you are going to consume. Is it going to be sugar, a chai with 4 cups of sugar in it, or some very processed biscuit, to the time you go to bed, on how is your sleep. All the decisions you make in the day, कि मैं क्या खा रहा हूँ, मैं क्या पी रहा हूँ, मैं किस तरह life जी रहा हूँ. For every product category which you are consuming, there is a healthy alternative which makes it a preventive healthcare model or preventive healthcare business. So for every snack, there is a preventive, there is a healthier snack. For every refined oil, there is a healthier oil. For every category of, even when you wear clothes, clothes can also define whether you are a more sporty or athleisure, the athletic category, or whether you are in a different category. So the category, so when they say 197 billion, it's because prevention mein ye sab included hai. It is the food you eat, the clothes you wear, the experiences you go. So if you are choosing to go into a movie theater versus choosing to go for a trek on a weekend, that also adds to the preventive model. So it's a very, very huge market, which is why startup opportunity in this space is 100x of the traditional healthcare space. Why? Because not everybody is sick, right? At any given point of time, population का एक percentage या तो admitted है या clinic में बैठा है, but I assume, touch wood, hopefully 90% लोग तो अभी भी hospital के अंदर नहीं है. So preventive healthcare market is that market of the people who are still not in a clinic or not yet hospitalized. And once they go out of the clinic or hospitalized, they automatically come back into the preventive market.
So that's very interesting. I think you're really saying that a lot of preventive healthcare is on us. The onus of it is on us and the personal choices that we make day in and day out on multiple items, right? So if I maybe come to the journey of health tracking as well as the role that wearables play in it, you're the founder of GOQii. So over the years, how do you see the journey's been in terms of tech adoption, and how is it really helping us track ourselves better as individuals? So maybe you can talk about that. Yeah.
So once again, right, I think when I talk about health tracking, health data, wearables, people are again confused on what is the business. Now let me give you an example. A hotel over here, you have a room, you have room service, you have a bed, you have somebody who makes the bed, somebody who gets you food. A hospital, there is a bed, there is somebody who's there to assist you, there is somebody who's getting you food, there is somebody even giving you support. So how is a hospital different than a hotel? The difference is the intention of what your purpose of being there is. Similarly, when it comes to devices and data, Just wearing a wearable device or a watch or some tracker does not make you any healthy. Similarly, just eating something which you think is healthy or taking a blood test itself is of no use. It is just what I call junk data. It's what you do with the data is what is the solution. So at GOQii, our business was never a wearable business. You will never see us claiming to be selling more wearable devices because उसका कुछ use नहीं है. 90% लोग को पता भी नहीं है कि वो style के लिए पहन रहे हैं. What we are saying is wearables and healthcare data in itself is of no use, but once this data is created into actionable insights, and then depending on your condition, you need personalized advice. That depending on my weight or my blood group, etc., or my cholesterol level, you need the right advice. So the business model which we have adopted is to build services on top of data. So initially we have our own wearable, but going forward, you could connect any device because we are not really trying to sell you a device. What we are trying to do is make sense of the data and provide you services which can benefit you. So the model is around what I call building services on the top of Internet of Health.
So that's very interesting because I think, in the last conversation also the whole thing of data came through that there might be a lot of data sitting in multiple places, but getting it together and using it for something meaningful is difficult. So I know Urvashi is not here, but this is a question really for the policy and the government space. So there is a lot of discussion on using data. There's going to be an Aadhaar number. So with all of that, what's the understanding in terms of, how will we leverage this data? And what about the privacy and ethical considerations that come with leveraging that kind of personal data, health data?
Urvashi is not here from NITI. The government is doing a lot of work on data privacy and security. But again, I go back to saying the first thing that the data security starts with you personally. Just like today, we have been told 1 billion times on every message ki don't share your OTP with somebody else, right? So today, after years, iske baad bhi we know people who get scammed into all kinds of things. So in financial data, I would say that because of UPI and all the digital banking, there is a very high awareness of people saying that mera OTP nahi dena hai, mera password nahi dena hai, ya mera date of birth. People have started understanding that this data of mine has the ability to be misused by people, and we all know people who have been scammed in some way or the other. Unfortunately, currently in health, people don't have that instance in their mind. In fact, I jokingly say कि आप कोई भी hospital के अगर आप बाहर जाओगे तो आपको भेलपुरी कोई medical report के अंदर ही मिलता है, right? The भेलपुरी वाला is basically selling you all the things in a medical report. So outside the hospital itself, there is total disregard of health information. It's sold in Raddi to a lot of people. So the first onus is going to go back to the consumer to say that this is valuable data for me. And then of course, whether it is the provider, the hospitals, they will start valuing it only when I start valuing it at my end, or there is some kind of, let me use the word, loss associated with it. Currently, consumers are not able to see this loss because the loss हो रहा है आपको पता भी नहीं है क्या loss हो रहा है. I think that's really the challenge.
And also, I think right now maybe consumers aren't giving that much data, right?
No, like every blood report, right? I mean, technically every blood report today is digitized. It is either in some printout or in some file. At least the diagnostic space, there is a whole host of digitization. But where are these reports? Which one central repository has this report? Nobody knows.
Yeah, so I think that was touched upon in the previous session, that's a challenge at a claim level and integration of the hospital system in terms of handling claims. So, data is one point. The next one is really for doing preventive healthcare at a large scale. How can technology enable it? We've talked about some of the digital stuff that's already happening, so there are ecosystems being built. but to enable it to reach, across socio-economic levels. How can technology continue to enable it? Because today it's uneven. You will not have preventive healthcare across the country at all levels. So how the government is doing a lot, of course, and now you have to answer on behalf of both Urvashi and yourself. So how can technology enable this for everyone in the country?
So I think the example we need to first see is UPI, right? Because of UPI, what happened is a lot of transactions started getting digitized. Every time you were paying a kirana shop or a vendor, suddenly that transaction of his or yours to them started coming digitally. Because of which, suddenly platforms like Paytm, etc., started telling the vendor कि अरे आपके पास इतनी transactions है, I can give you loans, I can start lending. And this particular vendor who was taking loans from some loan shark at some crazy percentage, suddenly उसको लगा कि अरे यार मतलब ये तो बहुत अच्छा है, मुझे Paytm से ही अभी loan मिल रहा है. And they all started installing those sound boxes and their QR codes. So the business of payments actually is not making money from the payment itself. In fact, it is zero MDR. The business actually has moved to lending and all kinds of financial products and services which was created on top of this. What I also believe is with health ID and all the digitization which is going to happen in health, the real businesses will move to how you will use this data to provide services which are going to be differentiated. And, given your background in the world of insurance, I think it is going to have the biggest impact on insurance underwriting. Because today the insurance company assumes कि सबका risk सबसे high है. So the premium is charged assuming you are the worst risk. Because the same thing was happening with loans, right? They did not know whether you have the capability, so they were charging you the highest rate of interest. So the same thing is happening in today's insurance world where our penetration is low because it's very expensive. But the minute the data starts opening up, you could create models which will say that person X should be having a different premium or a different plan versus person Y because of the data delta. So what you're going to see is a lot of disruption in use cases of data, which we have already seen in the world of payments and banking. So I think the next big industry which is going to disrupt is going to be healthcare and insurance and everything surrounding it, because suddenly the data which is currently opaque will become completely transparent.
I think that's a very interesting point, because currently when we even look at health insurance, there is data being used, but with it becoming less opaque and more usable, definitely there will be more and more opportunities in insurance as well. And I think COVID changed a lot in the industry. And the last 3 years, we've seen the whole health space exploding, so to say. So it's really a very relevant topic, I think, for a lot of us sitting here. So this data, this tech tools, from a AI and ML perspective, do you see that we will also now start seeing some use cases? We see very few use cases now, though a lot of work is started. But over the next 5 to 10 years, do you see AI and ML also transforming this and taking it to the next level?
So once again, right, so currently when people talk about AI use cases in medicine and on, let's say, once you are already sick, trying to look at your data, it's like looking at the data of all car crashes and figuring out ye crash kyun hua. The reality is the crash happened because the driver didn't sleep the night before, or because they was intoxicated, or because he was distracted. So unless you are able to look at the longitudinal data of what happened which led to this, that is really the holy grail of AI. So I think the model's jobs is now to figure out, looking at an outcome, what could have been the path of this person reaching here, and what could have been changed in the path by looking at training, by getting themselves trained in models like this. So the real innovation will come in not saying ki, what is the probability of you getting cancer? unfortunately for us living in India or breathing the polluted air, everybody has more, chances of every disease. So by telling you कि आपका ये percentage chance है कुछ नहीं हो सकता है. But if somebody can actually tell you that these are 5 habits you should be able to change today, and this is going to change these 4 biomarkers in your body, which is going to lead to your mortality risk reducing. So I think that is going to be a very, very big use case of AI, because humanly it is, anecdotally लोग देख सकते हैं ये, but humanly it is not possible to process all this information. And the second thing which again I think AI will be really, really good at is scaling healthcare. Today, we have very poor doctor-patient ratios. I mean, every ratio in India is bad. So there is a massive opportunity to scale the level 1, let's put it that way, of the first point of contact of a person with the healthcare system. And today the experience is very poor. We all know that. The first point, that's where वो बोलते हैं ना कि आप यहाँ से बटन दबाओ, आपको 10 मिनट में समोसे, छोले, भटूरे सब मिल जाएंगे, पर एम्बुलेंस मिलने का चांस नहीं है, right? Unfortunately. I know you are building those services, but that is the problem. And that is the problem which needs to be solved, which, maybe you should talk a little bit about how you are solving those problems versus delivering things which you may or may not need in 10 minutes.
Absolutely. So I think that's a very good one, that how do you do the last mile delivery? And, as Vishal is saying, that we jointly developed this product with GOQii and Bajaj Allianz, which is really a senior care product, which means that if your parent is alone at home and they have a fall, God forbid, or they're keeping unwell and they need immediate assistance, the device was specially made to fall, and it would trigger a service from our end. So from a last mile delivery perspective, we've stitched together an ambulance network across the country. And this enables us to respond in the golden hour. And the ETA that we promise here is actually 10 minutes if an ambulance is needed. So here, you're able to talk to the person immediately and offer assistance and send a doctor if required. So I think that helps.
And that's the question of prevention, right? Just everybody knows that if you can respond in the golden hour, 99% cases of deaths can be prevented. We all know that. But we are still seeing people missing that golden hour, which is leading to mortality. But whether you like it or no, आपको समोसे और छोले और burger आपको 10 मिनट में मिल जाएंगे, which possibly is contributing to the poor health. But that is the mismatch on the priority and investments across the sectors, right? I mean, that's the problem.
Absolutely, I agree. And, that brings me to the question again that there is a lot that is happening from a business perspective. A lot of people are seeing this as a business opportunity. So we're all here because of that also. But from a, people perspective in India, what all is the government doing to really get preventive healthcare at scale? Because if you want to enable it at scale, the government and policy has to play a very, very key role in a country like ours.
So I think, again, we are very lucky to have a government which recognizes the importance of prevention. I mean, the Yoga Day, for example, right? The best preventative exercise anybody can do in the world is 15 minutes of yoga of any kind. I mean, we all know that. And the government took that as an initiative to bring it on top. Fit India, right? Again, we had a movement. Similarly, the PHCs which are being set up are all going to get converted into wellness centers. There is the Ayush ministry which is talking about, Ayurveda is all about holistic health. So while at one end, definitely the Western medicine and hospitals, and we need all of that, but the preventative part of the healthcare has massive promotion. Of course, it takes time. This is just taken, like NHS, for example, in the UK, is also completely moving to a preventative model. So we have now launched, by the way, our services in the UK, where their model is actually completely different than India. Yahan, if you ask a hospital or a clinic, they say, "Meko patients chahiye, bhejo patients." Because their business model is patient coming into OPD, that's their walk-in, and they convert that OPD to IPD. So they make money every time a patient walks into their clinic. NHS का उल्टा है, उनको चाहिए कि patient वापस नहीं आए क्योंकि government is paying for it, So they are saying that if you are diabetic and if you're coming back again and again for consulting, each consulting costs them, I'm just giving about 200 pounds. तो हर बार आप वापस आ रहे हो, गवर्नमेंट की जेब से 200 पाउंड खर्चा हो रहा है. तो उनका कॉन्सेप्ट है कि किस तरह I can prevent you, of course in the right way, not by blocking your access, but prevent you from coming back again and again to the clinic. So that was the ethos in which NHS is now thinking of how do I reduce readmissions or revisits. And that is the mindset shift we want in the healthcare system of saying कि is a person walking into my clinic a lead जहाँ से मुझे पैसे बनाने हैं कि वो ना आए मेरे clinic में और healthy हो जाए ताकि he can do something. And so there is a business model challenge in this whole thing.
Yeah, I think that's a very good point. And the business model challenge is here to stay. I guess it's going to take its own time to go away.
US में you saw why is tooth extraction $5,000, right? I mean, it makes no sense why something which is a few hundred rupees in other parts of the world, again because of the business model challenge is there.
So, because you're talking about the business model, and here you're talking about both preventive and curative, how do you see the business models changing over time and the industry evolving? Slowly, curative is becoming smaller and preventive is increasing. Do you see that trend will continue, and how do you envisage that?
See, like I said, curative is an episodic occurrence, right? You don't fall sick every day. You don't hopefully get hospitalized every day. So curative is episodic, and episodic things happen to everybody. It could be an accident, it could be anything. The point is that episodic में investment चाहिए, but उससे ज़्यादा investment चाहिए in what happens recurring. Recurring is you smoking every day, you drinking every day, you eating fried food every day. That is the problem, which is a recurring problem, versus you recurring back to the hospital and back to the clinic. Actually वो बहुत late है. अगर आप बार बार clinic या hospital जा रहे हो तो आप समझ लो कि you are already coming to a very bad phase. So that is what needs to be fixed, what is recurring.
So it's interesting because you've brought the onus again on the person, which is good. And I think that's where a lot of us sitting in this room, and especially all those who are in digital startups, are making a huge difference because, before I got this wearable, and I don't use it for too many things, it's mostly to see the time and the steps. At least there's still some semblance of knowing, am I doing something for my health? A lot of apps that are being created in India today, they are preventive and truly preventive in nature. And we see that, you're having corporates get them to download, employees download some of these apps. Some people are more conscious, they do it themselves. So do you see these apps making a genuine difference in people becoming conscious and actually reducing curative over time? Because India is obviously the center of NCD almost. Given our sheer population size, we have a high number of NCD. So how do you see this evolving?
I think Urvashi is here. I think we should quickly
Urvashi
invite you.
Oh, that's wonderful.
And you can
Yes.
repeat some of those questions.
Absolutely. So I've asked some questions already, and we are so happy to have you here. No, not at all. So he's answered almost all the ones that pertain to industry and private sector. So all the ones for government are now directed towards you. So happy to have you here, Urvashi. And one question that we had was that, what is it that the government and policy is really doing to enable preventive healthcare to scale up? Because it's a challenge in our country. And how do you think you're able to, over time, get this straightened across socio-economic groups?
So I think, when we see from the policy point of view, one, I think, big shift that we have been seeing now in the last few years, and I think also post-COVID, is in mindsets. Because I think that is the first most important thing, that the mindset of our health system needs to be reset from curative to preventive. We have been a very cure-focused health system historically, a very hospital-based health system. Whenever we talk of healthcare, it's immediately doctor, hospital. You'll never talk outside these terms. So I think just changing that mindset, changing that vocabulary, I think it started to happen. We have a long way to go, but I see that shift in the even in the policy space. With programs like, for instance, you have the health and wellness centers, which the government is trying to set up under Ayushman Bharat. And I say trying to set up because while the physical infrastructure might be there, we still need to roll out, things like screening for non-communicable diseases, and we need to build the human resource capacity. So I would say it's still work in progress, but it shows that the mindset is shifting. So I think the challenge for us is that we need to create an enabling environment where people can actually take charge of their health. We need to make sure that there are no cost barriers to this, or geography barriers that somebody in rural areas cannot have access to, say, a particular technology that somebody in an urban setting does. So I think from the policy point of view, these are challenges, that how do we make an enabling environment. But I think the mindset shift, the fact that we want to now, focus more on the preventive side, talk more about public health care, I think that is certainly encouraging. And, we need to continue to obviously push in that direction.
Okay, and, to enable this at scale, what is technology playing in terms of really helping you take this to the general public? Because we spoke about what private sector is doing in its own way, and of course it's a business that's evolving and growing. So has technology been an enabler for you?
Yeah, I think technology is a big enabler, and I think it'll only play an increasingly bigger role, in the times to come. But already, even during the pandemic, we saw a real growth, in the use and adoption of something like telemedicine. Earlier telemedicine was, telemedicine is not a new concept. But it was very difficult for us to, ever find the kind of scale in that. But suddenly after COVID, when we all were in a way compelled to follow those norms, etc., we saw that, the penetration of telemedicine really went up, and some of it also went up in, centers which were not your, typical large urban centers. So even in some more, smaller towns, cities, etc., you did see that adoption going up. So I think definitely, COVID is going to be a very important kind of point for us in terms of our technology adoption. But as I think, as I said, that from our point of view, government point of view, policy point of view, it's always important that these technologies reach, everybody. The technology itself should not be a barrier. It should not be something which, some people can access, others cannot. So that is where the government's job comes in. And a lot of it has to happen through public-private partnership, where we can actually take these technology-enabled models to the last mile, and scale them up. I think integrating technology with health and wellness centers is something we're really exploring. That, how do we integrate? Because that is how we're going to build our comprehensive, primary health system, where a lot of your preventive aspects are actually going to come up. Prevention, early detection also I kind of count as an extension of, prevention, and a very important extension. So, so I think that is, what we need to do, but I think technology has definitely a huge role to play, and we're already seeing the kind of disruptions positively that, it's causing in the healthcare space.
So completely agree with you that, COVID was an inflection point, and I think it sort of really changed the way we see preventive healthcare in India. So you spoke about the barriers and challenges that you still have, and technology being an enabler. So, what are your top barriers that you see even now? Is it mindset or some other barriers? And do you think that there can be even more private and government partnership, private-public partnership to address some of these?
Yeah, I think definitely, I think the private sector, there's some fantastic innovations also happening. In fact, we saw so many startups, during the COVID time, and because as NITI Aayog, we were also trying to, channel the work of these startups into the sort of the government's efforts. And sort of build a bridge. So we actually came across a lot of startups, other organizations doing very innovative work. And I think now the question is, how do we really scale it up? How do we take it to the last mile? And for that, we do need, public-private partnerships. For instance, if someone's developed a technology-enabled, sort of solution, screening solution, for COVID, I mean, we can use it for TB, we can use it for so many other things. So also the innovations that happened during COVID, how do we make sure that, we continue to use them in other ways? So I think all of that, there is huge scope for public-private partnership, not just at the central level, but actually at the state government level. A lot of this action, can also happen, and to some extent is happening at the state government level. So I think, I see that we will be able to overcome, some of these barriers through this partnership. And now we are, in fact, also taking technology, or at least, attempting to take technology right to the grassroots. So, some of you might know that we've had this aspirational districts program that the government has been implementing, where, we try to improve indicators in some of the most, we don't use the word backward, but some of the districts which have been, kind of left behind the most so far. Now we've actually launched an aspirational blocks program. So now we are going even more, granular with the whole development paradigm, and we're trying to see how we can use technology effectively at that level to, improve outcomes in health, improve outcomes in education, and so on. So I think the scope is tremendous. Like I said, the good news is that the mindset, I definitely see some shift. Because I'm a public health person, so it always frustrated me that nobody wants to talk about preventive health. That was always very frustrating for me, that we always spoke about hospitals and insurance and doctors, and, we never spoke about public health, we never spoke about prevention. So now I see, a lot more sort of receptivity to that, and so I hope we'll, continue in this direction.
Sure. So I had just one last question for you, and then we'll open it for everyone. So the one that I asked Vishal, on your behalf, I asked some questions, right? So this one's on data, Urvashi. So there is a lot of work that now the government is also wanting to do to, leverage data. And we seem to be a very far distance from that. But how do you envisage, leveraging data to even drive preventive healthcare more?
Yeah, I think data, in fact, I was just in a meeting on data that, I got late, because of that. And we were just talking about data and the power that, it has in terms of helping us make better decisions, in the policy sphere. And so I think there's a lot that is happening even on the data side. I mean, one is, of course, improving the quality of the data that we collect at different levels in the system. The other, and more importantly, is making better use of it. Because, we collect a lot of data. Now, a lot of it is also coming in digitally. But because of harmonization issues, other, we're not actually using it as well as we can. So we're not deriving the kind of insights from it that we can. So I think that is something that, we're going to be really focusing on. And then also, aspects like putting out that data, in the public domain, being more transparent, building accountability, in health governance with that data. Now, of course, when it comes to health data, we do have to deal with issues of privacy and security, and, those are very important issues. And so I think we will continue to, have to deal with those and come up with the right kind of frameworks around that. But I think there's no doubt that there is now, this question is being increasingly asked, that how do we better use data, to improve our governance in the health sector, and also drive accountability, transparency, from the citizen point of view.
Sure, thank you so much, Urvashi and Vishal. And if anyone has any questions for the panelists.
Hi, my name is Parikshit. I am from the insurance industry. And this question, especially from insurance, you spoke about accountability and transparency, and insurance is heavily regulated as it must be. Is the government also thinking about, or what are your thoughts on say, bringing about some sort of accountability and transparency or regulation on the provider side? Because while there is a lot of push towards the insurance sector to standardize prices and products, benefits, so on and so forth, but it kind of becomes unstuck because when we are interacting on the provider side, there is not as much level of, say, transparency in the pricing mechanisms and what is being charged to the end customer.
Yeah, I think that is definitely a challenge, and that is because lot of our health system is either informal or small establishments. When we say private sector in health, a lot of it is actually informal, or a lot of it is very small, 2 or 3 bedded establishments. So regulating those is obviously, it is a big challenge, and I think that's one of the biggest governance challenges we face. So there are a lot of initiatives which are underway, again, not just central but state. A lot of this happens at the state level as well, the center sort of just provides a broad framework, but the actual action happens at the state level in terms of the kind of regulation that they roll out, etc. So yeah, I think there's no easy answer to this, but this is a big challenge, and this is something that I think policymakers are well aware of, and we are certainly trying to take steps, but it's just that the heterogeneity of our health system is a reality, and we have to do a lot to address that, to bring all the providers into a network, which is something we are trying to do. We are trying to see that, even if it's an informal provider or a small provider, how do we bring them into, the network of other providers? How do we integrate their data sets? How do we, understand better what their practices are? So I think there is, action in that direction. But it's not a small challenge, that this is a very, very big challenge that we face. Yeah.
Do we have any other questions? All right then, thank you so much. I'll request you all to take a picture for us together.